Hi everyone, welcome back. If you are an internationally qualified nurse preparing for OSCE exam in New Zealand, this video is for you. Many nurses feel nervous about OSCE, but the good news is you don't need to memorize complicated script to pass. What you need is safe nursing practice, clear communication, structured assessment, cultural awareness, and professional behavior. Today, I will walk you through how to approach OSCE confidently, a full pain assessment scenario, what help you pass, and also important steps you should follow. Let's start. OSCE in New Zealand assess entry-level RN competency according to the standards of New Zealand Nursing Council. Examiners are observing patient safety, communication, clinical reasoning, cultural safety, professional accountability. It is not about memorizing textbook answers. It is about demonstrating safe, patient-centered nursing care in a New Zealand context. Let's go through a realistic OSCE scenario today. The scenario is you are a registered nurse working in a New Zealand medical ward. Your patient name is Mr. Viravmu, 65 years old patient. Post-operative day 1 after abdominal surgery, he reports pain. Step 1. Always follow professional introduction. You enter the room. First, perform hand hygiene. Follow the hand hygiene moments. Then introduce yourself. You can say, "Hello Mr. Viravmu, my name is X or Y. I am your registered nurse today." Then you can identify the patient. Confirm identity. Can I please confirm your full name, date of birth and the NHI? NHI number is the National Health Index number. This is the registration number for everyone in health or the hospital. And I understand you are experiencing some pain. I would like to assess it so we can manage it effectively. You can explain you the purpose and also you can ask, is that okay? Then why this help you pass? Shows consent, shows safety, shows professional communication. Then step 2, open-ended questions. Always ask open-ended questions. Starts with, can you tell me about your pain? Then let the patient speak first. Do not immediately ask a number or don't interrupt the patient. This shows patient-centered communication. And step 3, structured pain assessment. You know this PQRST model. P is like provocation. You can ask, what makes the pain worse or better? Then quality, how would you describe the pain? Then region or radiation you can ask. And also like severity. And also the timing, when did it start? Is it constant or intermittent? You can ask. Then this shows the structured assessment and clinical reasoning. Step 4, observation and clinical thinking. So you have to observe the facial expression, guarding, vital signs, surgical site, and also you think post-op day 1, their reports pain score 8 out of 10. Then requires intervention. Examiners wants to see what you think critically, not just asking questions. So step 5, cultural safety. So cultural safety is very, very important in New Zealand. Cultural safety matters. You may ask, is there anything important I should know about your culture or spiritual needs while managing your pain? This demonstrates culturally safe practice and respect. This is highly valued in New Zealand OSCE. Step 6, plan and intervention. You say, your pain score is 8 out of 10. I will check your medication chart and administer the prescribed analgesia. I will reassess your pain in 30 minutes. Important. Always mention reassessment. That's very, very important. Then, reassessment shows accountability and safe practice. Step 7, escalation if needed. If pain remains severe, I will escalate this to the RN in charge or the medical team if the pain is not relieved. This shows understanding of scope, safe escalation, professional responsibility. This is one of the OSCE pain assessment scenario example. So this can apply like any of the station. You can take the you can understand this and you can apply to. And next we can see what examiners are checking. First one, they will look or they will check, perform hand hygiene, You confirm patient identity, you gain consent, use structured assessment, communicate clearly, provide safe intervention, mention reassessment, consider cultural safety and escalate appropriately, and even documentation. So always use a pain scale, never skip patient identity check, and always mention reassessment, always think about safety and communicate respectfully, always stay within the scope. Remember, OSCE is not testing perfection, it is testing safe, competent practice. Common performance tips we can check: speak clearly and calmly, avoid robotic memorized speech, think before answering, maintaining professional body language, stay patient focused, confidence. Finally, if you approach OSCE with structured assessment, patient-centered communication and cultural safety, you are already on right path. Preparation plus safe practice equals confidence. If you found this helpful, please subscribe and follow us on Instagram and Facebook and watch more videos. Thank you.